Another week, another strike. This time, thousands of ambulance workers and other 999 staff in England and Wales will walk out on Wednesday in a dispute over pay. The minister in charge of the government response offering no guarantees on what that will mean for emergency call-outs.
We have expressed significant concern about the impact that will have, and we would urge ambulance strike leaders to call it off even at this late stage. We are working incredibly hard to make sure, particularly in the most urgent cases, people are able to get their ambulance.
Nurses in England, Wales and Northern Ireland will also walk out on Tuesday, their second day of action, with potentially more to come next year.
It's an incredibly heart-wrenching decision because on the one hand, there's the feeling that I'm letting my patients down if I don't attend work. But then there's also the feeling that I'm letting my patients down if I don't make my voice heard and go on strike.
Around 600 troops will be drafted in to drive ambulances during the strikes, with other personnel and clinicians taking on support roles. But there's some concern in the military. The Chief of the Defence Staff, Admiral Sir Tony Radakin, has said while their ethos is to serve the nation, they're not spare capacity for striking workers and needed to focus on their primary role.
From floods to COVID, the Ministry of Defence is used to getting requests for help from other parts of government. But the issue of whether the military are being used readily as a policy response rather than a last resort is a live question here. Then there's the point that troops who can't strike are generally getting a lower pay rise than the workers they're being asked to stand in for, an awkward fact that's not lost on ministers.
Some in Rishi Sunak's party now want him to reopen pay talks with health workers, something he's so far explicitly refused to do. NHS leaders say winter pressures and strikes are a damaging mix.
I think we're disappointed this morning, but what we're hearing, it seems from all sides, is rhetoric, when what we need is imagination and a commitment to try to solve this dispute, because it's coming at the worst possible time in terms of the pressures facing the NHS.
Where do we want it?
But with health unions and the government dug into their positions, for now, compromise feels a long way off. Rob Powell, Sky News in Westminster.